Hi, my name is Caroline Jojo, and I'm going to be starting off my group's presentation for our epidemiology project. And Marina and John are going to present the later parts. So, for our project, we're going to focus on stomach cancer and the association with H. pylori infection. So, we're going to start by giving you some background info, and we're going to start with the biological cause of stomach cancer, move on to the types of stomach cancer, and then go into some symptoms before moving on to the incidence and prevalence. So, for the biological cause, like all cancers, it's a genetic mutation in the DNA, but for stomach cancer, it's specifically in stomach cells, and this causes the cells of to continuously grow and to eventually form into a tumor. And some types of stomach cancer that we want you to focus on are adenocarcinomas, which is the most common type of stomach cancer, and it begins in the mucus-producing cells in the innermost lining of the stomach. This can further be broken down into gastric cardia and non-cardia gastric. Gastric cardia is in the top inch of the stomach versus non-cardia gastric, which is in any other section of the stomach. There's also gastroesophageal junction adenocarcinomas, which is a type of cancer where the esophagus meets the gastric cardia at that junction point. There's also gastrointestinal neuroendocrine tumors, which is cancer in neuroendocrine cells that line the gastrointestinal tract. This causes there to be digestive juice issues as well as muscles that move the food through your organs. So overall, you're going to have digestive issues. There's also gastrointestinal stromal tissues, which is a type of soft tissue sarcoma, which is cancer in the nerve cells in the wall of the stomach and organs. Finally, we have primary gastric lymphoma, which is a type of non-Hodgkin lymphoma. And now John's going to take over.
I want to talk about the symptoms, and the symptoms for stomach cancer are such as having trouble swallowing, belly pain, feeling bloated after eating, feeling full after eating full amounts of food, not feeling hungry when you would expect to be hungry, heartburn, indigestion, nausea, vomiting, losing weight without trying to lose weight, feeling very tired, and stools that look black. And as I go to the graphs, the presentation of the graphs, we have three graphs, and the first graph depicts the general incidence and mortality rates for both men and women globally to be about 11.1%. And the second graph depicts the incidence rate for men and women globally. Whereas the third graph shows the mortality rate of men and women globally. And I want to say that more cases are being reported in developing countries. For example, third world countries like in Africa and some part of Asia, like Nepal, whereas low rates are being recorded or low levels of stomach cancer are being recorded in developed countries like USA, Germany, and most of Europe. And now I'm going to pass it to my colleague Marina, who is going to continue from there.
So this slide provides an overview of the national prevalence and projected impact of stomach cancer in 2025. On the left, we see that approximately 30,300 new cases of stomach cancer are expected in 2025, accounting for 1.5% of all new cancers nationwide. Below that is projected that there will be 10,780 deaths from stomach cancer, representing 1.7% of all cancer-related deaths. On the right, we see a 5-year relative survival rate of 37.9%. This means that only about 38% of patients diagnosed with stomach cancer are expected to live at least 5 years post-diagnosis. At the bottom, this chart illustrates trends over time from 1992 to 2023. And the light green line right here shows the rate of new cases, and the dark green triangles represent the death rate. While both rates have gradually declined over the years, the death rate remains high relative to the incidence, emphasizing the need for early detection and improved treatment options. This chart illustrates the age standardized prevalence of stomach cancer. in the United States among adults aged 20 and older. So we can clearly see that stomach cancer is much more common in older adults, with the highest percentage of new cases at 29.3% in people aged 65 to 74, followed by 55 and 64 and 75 and 84. Only 1.7% of cases in those aged 20 to 34, and it is extremely rare under the age of 20. This slide represents the adjusted incidence rate, age-adjusted incidence rate of stomach cancer across the health service areas in Texas from 2017 to 2021, covering all stages of the disease and all races and sexes. On the right, the scatter plot represents the various HSA by incidence rates. Each blue dot represents a different region in Texas, allowing us to compare geographic disparities. The horizontal axis shows the incidence rate of 100,000 people, ranging from just over 40 to nearly 10. So notably on the left, if you see notably regions like Maybrick and Cameron and El Paso have higher incidence rates. And while areas at the bottom, such as Bowie, Texarkana, and Nacogdoches report the lowest rates in the state. So this variation suggests that environmental, socioeconomic, behavioral, or access-related factors may influence stomach cancer risk differently across regions. So this is a diagnostic testing, and diagnostic starts with a medical history and physical exam. An endoscopy is used to look inside the stomach and take a biopsy. And images like CT, barium, swallow, and MRI, they check if the cancer has spread. And so barium swallow involves drinking a liquid that serves as a dye to make the stomach lining more visible on an X-ray. Also blood tests, and they assess organ function. And also the laparoscopy, which is a small surgical procedure that is used when other methods are not enough. And it's good to know that there's no standard US screening since the stomach cancer is relatively rare. I will now pass it to Caroline for prevention.
So, some ways that we want to discuss about preventing getting stomach cancer is to treat an H. pylori infection, which we are going to go into later about why this is so important, and also to treat any ulcers, gastritis, and other stomach conditions quickly and not prolonging your exposure to them. Also, eating healthy, such as a diet with high in fruits and vegetables, low in salt and red meat, as well as high in vitamin C, beta carotene, and carotenoid. And then also, it's important to avoid smoking tobacco products and to maintain a healthy weight. And some treatments that we want to highlight for stomach cancer is, like we mentioned in the diagnostics, it's an endoscopy. So rather for this one as a treatment, a upper endoscopy involves having that endoscope have basically a blade on the end of it, and it cuts the tumor out from the stomach wall and removes it from the mouth. And then there's a gastrectomy, which is the removal of a stomach. And this could be either part of your stomach, which is called subtotal gastrectomy, or your entire stomach, which is a total gastrectomy. There's also chemotherapy, which is drugs that are involved to shrink the cancer cells, as well as radiation, which is targeted beams like X-rays used to destroy the cancer cells. And this is often used as a combination treatment with chemotherapy. Then there's targeted drug therapy, which targets only cancer cells and is only really used when it is a really strong cancer or it's a reoccurring cancer. Finally, there's also immunotherapy, which helps the immune system kill cancer cells rather than killing the cancer cells directly. And some risk factors that we want to note is being of a older age. So like Marina had mentioned in the age-adjusted graph, you can see that as you age, there is a significantly higher risk, as well as being a man, just like what John had mentioned in the global incidence, we can really see that men have basically 2 times as likely of getting stomach cancer. Also having a South Central American or Eastern European background, your family history of stomach cancer or polyps, H. pylori infection, gastroesophageal reflux disease, Epstein-Barr virus, and a diet high in fatty, salty, smoked, or pickled food. Diet low in fruits and vegetables, frequent exposure to coal, metal, and rubber, smoking, vaping, or chewing tobacco, excessive alcohol drinking, obesity, and autoimmune autotrophic gastritis are also all risk factors. There's also specifically genetic risk factors, which are things that aren't about your lifestyle. So things such as Lynch syndrome, Peutz-Jeghers syndrome, Li-Fraumeni syndrome, familial adenomatous polyposis, hereditary diffuse gastric cancer, and common variable immunodeficiency are all things that you would inherit from your family.
And so stomach cancer itself does not have a route of transmission like like an infection disease. However, certain risk factors that can lead to stomach cancer do have identifiable transmissible routes. And the most significant, as you can see here, is the Helicobacter pylori or A. pylori infection, which is a bacterium strongly associated with the development of stomach cancer. And the way H. pylori spreads is through oral to oral contact, like saliva or shared utensils. Also through fecal to oral from contaminated food or water, such as in communities with poor sanitation and hygiene practices. And also through gastro to oral, uh, through vomit or reflux, especially in caregiving or healthcare settings.
So now we're going to talk about specifically H. pylori association with stomach cancer. And so, like we mentioned before, there are a ton of risk factors for stomach cancer. However, H. pylori does have the highest risk factor. And so we can see, like John had mentioned in the global incidence, Eastern Asia has a very, very high incidence rate compared to global rates. And so all the studies that we looked at were conducted in Eastern Asia, mainly Japan and China. And so, looking at these studies, we can see that throughout all of them, all of the odds ratios are greater than one. So, we can see there is a very strong association between H. pylori infection and stomach cancer. And some things that we want to know about these studies in specific was, as we can see in the Limburg study, the odds ratio was much lower, as well as in the Cominager study as well. It's also only around 1.6. So even though these ones do have a lower odds ratio compared to, for example, the Yamari study, which had a 16.93 odds ratio, we can see that that is likely due to the fact that there are significantly less confounders that were controlled for. So there's a lot more outside factors that were affecting those results. But overall, for our conclusions, we just want to be able to show that there is a strong association between H. pylori and stomach cancer, and that we can see that across a variety of different studies. From this table, you can clearly see there were very large sample sizes, and collectively, if you take all the data together, there hasn't been anything that showed that there wasn't a relationship or that the relationship was due to chance. Next slide. So overall, we want to note that H. pylori is a major risk factor and how significant early treatment can decrease your chances of gastric cancer. It's also important to know that there have been studies that show that the earlier you treat your H. pylori infection, it really does actually reduce your chance of getting gastric cancer compared to later on treatment. The next slide is going to be just our references for those 5 studies if anyone's interested in looking further at them. And then the next slide is just all the information that we got for the incidence rates globally, nationally, locally, if anyone wants to explore that.
Thank you for everything, John and Caroline. This concludes our
Thank you.
presentation.
Thank you. Stop
How
recording.
long was that? So I stopped sharing already.
I think it's about 14 minutes, so I think we're good.
Ooh.